And ironically, if my cancer emotional journey, or my emotional roller coaster had gone well, I wouldn't be here, which is really remarkable. I'm here because I wanted to change things. So how bad things can kind of turn around. I really do believe that your emotional wellness is made up of attitude. I think there's a component of self-care, which I'm learning. Physical activity, and I don't think they're mutually exclusive, by the way. And I think nutritional wellness is just one of those components as well. Now, let me take you back. It felt like waves were just crashing upon me until I couldn't breathe anymore, till my feet were taken under me. I got breast cancer diagnosis, and I felt the lump. And then a week later, they found another breast cancer in the other breast. And so what was somewhat understandable to me as a physician became bad breast tissue, Alex. And it was a double mastectomy, double nodes. And then before the wound had even healed, all the nodes were taken out on one side, and I was given that white binder, and chemo was going to start, and here's a prescription for your wig. And, you know, I see the heads nodding. That's the vortex, right? Yeah, it wasn't even shortly after that, when I had mouth sores and I couldn't think anymore, that they told me I was carrying a BRCA1 mutation, and it was going to affect all my family too. And I don't really know how I was comprehending this, but I was moving along, and everyone was very supportive. And I felt like I was really passing a deadly virus, and I was struggling to do the right things, but obviously I was going to have to add the hysterectomy to all the surgery and at the end of everything as soon as my immunity could recover. The other part, don't forget, is that I loved my job. I'd worked so hard to be a doctor. I loved it more than anything. And it just seemed to be drifting further and further away as I was trying to breathe. No one could really push me in the right direction because all I could do was breathe. And I was seeing my job fade away, especially as I think my brain is like a Formula One car. It's oiled and it's multitasking and it's moving so fast. Well, halt now. I was like a rusty van. My brain was thinking like cogs turning like treacle. And so I really didn't have any mentors, to be honest. Confidentiality rules very well in doctors. So nobody talks about anything among doctors. So I had no mentors. As far as I knew, everyone just retired. So I was really feeling very isolated. You know what? There's one thing I did have left. Of all the brain gone, my body was now quite different. My hair was gone. I had attitude. Attitude was the only thing I could really look at. You know, I was taught by a very wise visitor to live in the present. And I did psychotherapy in my practice. Actually, I did a lot of it, but I just didn't realize, because honestly, a lot of people come in needing support every day. And I particularly liked cognitive behavioral therapy, CBT we call it. The whole principle is, if you change the way you think, you change the way you feel, and you change the way you behave. Good for me. That sounds great. So I did do what I thought I remembered that I did for patients, and I said, I'm going to make my positive thinking cards. I didn't just think of it like that. I crashed down and I made the stupidest mistake, and one of my friends said, well, that's not you. Just laugh at it. And then I realized I had all these thoughts going on in my head. I just needed to write them down. I called them positive thinking cards, but they weren't just like happy quotes, you know, the kind that you see on the internet and stuff. These were things I had done that had worked, so that I could recall my strengths and I could repeat that behavior. So it was phrases like, Alex, if you think of the negative, you miss the 1,000 positives. Go outside your comfort zone. You know, the wonderful phone calls not just going to come into your house. You have to go out and make those volunteer efforts. Pick up the phone. It's worth 1,000 thoughts. You know, that pain was so immense, it felt like my chest was blistering and weeping, and it wouldn't go away. And I could moan to my family that I was in so much pain, or I could go take a pill, and everyone would be happier. So that was another one, you know, take a pill. Don't complain, take a pill. So, you know, everyone can kind of relate to that. It was suggested I go to a support group, you know. No doctor support groups, a support group. I was a patient. Actually, I was actually a bit confused, to be honest. So I booked a visit, and, you know, there is a readiness to deal with cancer, and I realize that now. There's a readiness for help, and we have to hold that person's hand until that readiness comes. Okay, I wasn't there. I went in, start the car, I was so out of there. But I had not checked myself off the art therapy list, because I thought, harmless, and I kind of like art, so... the teacher called. In my competitive nature, I thought, well, I don't want someone else to take my spot, so maybe I'll try. And they said that I could be anonymous. So for 4 weeks, I was quite anonymous, and I wasn't a resource, and I was anonymous in the community. And it was only after a while that I felt that I could share. And in creating a clay mask, I realized I was hiding behind it. I grieved. I grieved what I'd lost. I grieved a world of hurt and unfairness and loss of innocence. But you know what? I found beauty in that. I found beauty somewhere in my art, where I could go to a place in my head where time stood still. That time where you go, where did 3 hours go? Because I was in this really lovely place. And so I move on to physical activity, because you know what? I love tennis. And really, how can you keep getting back? Because I broke so many things. It's a big part of mental wellness. You don't just move. You don't just put your arms around and create those happy hormones. It's a place in your head where you find a tranquility when you play tennis and when you do an activity you love. I don't care what it is, but you find that place. Tennis is a game of so much strength, but inside my head there's tranquility as the ball sails down the line, and I just whip my body around it. Now this is the body that lost all its pecs, and it had no breasts, and I had, you know, hysterectomy and so on. So believe me, there was an awful lot of not being able to get that ball over the net. But with time and good support, you know, I was surprised people wanted to play with me, but they found it inspiring. So I played with my scarf on, and they said, oh, when you played, I was inspired. If you were there, I certainly should be there. So fatigue was ravaging. I went back to work, multitasking job, and I was choked with how slow I was. But you know what? The enthusiasm was the fuel. You get together with people, and it's fuel. It gives you this incredible high. And I was this beacon of energy that said possible, and everyone wanted to know all about it. I had to forgive my fatigue, so, you know, my cards, again, I wrote another one, back to work card. Only the healthy you is helpful. This is where self-care comes in. Cogs started turning, and you know the resilience that Dr. Roden was talking about, post-traumatic growth, I call it. So when I broke my shoulder, 6 weeks into returning to work, because who wouldn't want a nice snowboarding trip as a carrot at the end of your treatment? So yes, so I broke my shoulder, and delegating the patients to put the blood pressure to cuff on while I was in my sling, wrote another card. Off the court again I was, gallbladder, inflammatory arthritis post-chemo. Then smashed my wrist. Now, who would ever think I could get back from that? But you really do have to pick up the pieces and have a lot of core belief in yourself. Attitude really takes you out of that hole, no matter how deep it is. But you have to really believe in yourself and find others who believe in you. Noticing this attitude was all I had left. And the power of the mind was fascinating. You know, I was asked to be on this video for Look Good, Feel Better. And they noticed my cards. I want these. We started this website facingcancer.ca. And I was one of the first bloggers. And we found that this was a site where women could share their emotional journey. And it was really the part that no one noticed. You know, I was trained to notice the side effects of chemo, how to prescribe pills. I really didn't know what a good listener was all about until I needed one. You know, the other thing I did know, though, was I was in a great position to be able to change this because I was a doctor. So if I could use that again and find it again, I thought I would actually go into this, you know, make psychotherapy part of my career and actually move towards doing that. But you know what came into my world instead was this job for Cancer Cure Ontario, primary care lead. So now I was a family physician in practice, and now I had the chance to change things from the top. And I was given this magic wand to do everything that I was already doing. I was already an ambassador for Willow and Wellspring and facingcancer.ca. And now I could put all that community and the medical profession knit together and know what they needed to do. So I'm on the Provincial Survivorship Advisory Panel and the Breast Cancer Pathway Guidelines because I think, you know, when I say I want to be on it, they say, we want you. So I have ideas for change. I know what I want to do in terms of having the patient guided through the journey. And I think it's the perfect place to be able to be the family physician in the community and the breast cancer patient. Maybe that's why I'm now in a Masters of Leadership provincially, a program that is run by the OMA. And I know why passion drives my path. Self-care, though. So we talked about the physicians. Well, wouldn't you know it? Wouldn't you know it? There is a program now, ProComp. And guess what? I'm going to teach it. And it teaches self-care, so mindfulness and art therapy and art interpretation. We feel if they're better at interpreting people's emotions and interpreting their own emotions, they're better at interpreting other people's emotions. So I want to leave you with some words. It's not how many times you get knocked down, but it's how you get up that counts. Life makes sense backwards. We were never meant to have this, and we have to course correct sometimes when things go wrong. We all have gifts, and we have to celebrate who you are. And don't overthink. I'm going to quickly, if I can, just read a poem, because these are on my blog, and I actually put together a book, believe it or not, as well. And so this one's called What is Survivorship? I thought it was kind of pertinent for today. Survivorship is an empowered state of being after cancer. It's the decision we make as we get out of bed in the morning, tired and aching. It's the ability to notice thoughts of cancer recurrence and be at peace with them. It's the power not to let cancer define you. It's the energy in your dancing. It's the determination in your winning. It's the stride in your running when exhausted. It's the bravery to go outside your comfort zone. It's the attitude to pick yourself up again for the 10th time when wounded again. It's the perseverance to adapt despite limitations. It's the courage to own a new body after treatment. It's the sincerity that makes hugs more meaningful and just simply more. It's all about possibilities. It's about noticing today and keeping balance in your life. It's getting rid of pretending and opening your heart to authenticity. It's all the rest that is left and deciding to fit it all in. It's the love that you radiate. It's your positivity of being. It's a belief in yourself beyond anyone else's. It's a faith and trust that help you calm fear. Survivorship is a state of mind we choose every day. There you go.